Hi friends, welcome back to my channel Mookambika Nursing. Friends, ഇന്നത്തെ വീഡിയോയിൽ MLSP NHM എക്സാം പ്രിപ്പറേഷൻസിനുള്ള ക്വസ്റ്റ്യൻസ് ആണ് ഇൻക്ലൂഡ് ചെയ്തേക്കുന്നത്. ഈ ക്വസ്റ്റ്യൻസ് പ്രീവിയസ് ക്വസ്റ്റ്യൻ പേപ്പേഴ്സിലെ അതായത് MLSP NHM എക്സാമിൻ്റെ പ്രീവിയസ് ക്വസ്റ്റ്യൻ പേപ്പേഴ്സിലെ ക്വസ്റ്റ്യൻസും പ്ലസ് എക്സ്പെക്റ്റഡ് ക്വസ്റ്റ്യൻസ് ഇൻക്ലൂഡ് ചെയ്തിട്ടുള്ള വീഡിയോ ആണ്. Mostly this question will help for your coming exam. We will see the questions. Let's ask the question. First question, the dye used for staining basophils is. Options are option A, eosin, option B, methylene blue, option C, purple dye, option D, all of this. Correct answer for this question is option B, methylene blue. The dye used for staining basophils is methylene blue. These basophils are type of WBC cells. Okay, WBC cells include monophils, lymphocytes, neutrophils, basophils and eosinophils. Okay, these basophils are type of WBC cells which is stained by using methylene blue. The next question, vitamins are stored in. Options are option A, pancreas, option B, gallbladder, option C, stomach, option D, liver. Correct answer is option D, liver. Vitamins, mostly fat soluble vitamins, are stored in liver, fatty tissue and muscles. Water soluble vitamins are soluble in water and mostly stored in shorter time, but fat soluble vitamins are stored in liver, fatty tissue and muscles. Here correct answer is option D, liver. And the third question, which dye is used for staining eosinophils? Options are option A, acid dye, option B, alkaline dye, option C, purple dye and option D, none of this. Correct answer is option A, acid dye. In the first question is the dye which is used for staining basophils is methylene blue. Here staining eosinophils is acid dye. The next question, third question, the blood cells which play an important role in phagocytosis is known as. Options are option A, RBCs, option B, WBCs, option C, platelets and option D, monocytes. Here the correct answer is option B, WBCs. WBCs function as an immune defense system of the body. Okay, the main function of WBC is to fight against the microorganism, and the different WBC cells include neutrophils, eosinophils, basophils, lymphocytes and monocytes. The next question, question number 5, weight of pituitary gland is. Options are option A, 30 to 40 gram, option B, 5 to 6 gram, option C, 0.5 to 0.6 gram, option D, 2 to 5 gram. Correct answer is option C, 0.5 to 0.6 gram weight of pituitary gland. The next question, collapsing pulse is also known as. Options are option A, bounding pulse, option B, water hammer pulse, option C, pulse alternus, option D, bigeminal pulse. Here correct answer is option B, water hammer pulse. This collapsing pulse is also known as water hammer pulse or Corringen's pulse or collapsing pulse. The next question, seventh question, rectal tube should not be kept in place for not more than. Options are option A, 5 minutes, option B, 10 minutes, option C, 20 minutes and option D, 30 minutes. Here correct answer is option C, 20 minutes. The rectal tube is inserted into the rectum to release the flatulence and gaseous distension of the abdomen, and it should not be kept in place not more than 20 minutes. Okay, and the tube can be reinserted every 3 to 4 hours. This is also important point. The tube can be reinserted every 3 to 4 hours. Okay. The next question, while giving enema, height of enema can from anus should be. Options are option A, 15 cm, option B, 25 cm, option C, 30 cm and option D, 45 cm. Here correct answer is option D, 45 cm. The height of enema can from anus should be, while giving enema, it should be 45 cm or 18 inches. The next question. Endoscopic catheters are sterilized by option A autoclaving, option B hot air oven, option C 2% glutaraldehyde, and option D boiling. Endoscopic catheters are sterilized by using 2% glutaraldehyde. Option C is the correct answer. This 2% glutaraldehyde is used for sterilization of endoscope, cystoscope, and rubber catheters. It's an important point. Endoscope, cystoscope, and rubber catheters. The next question. Most common complication of spinal anesthesia is. Options are option A anorexia, option B hypotension, option C hypertension, option D mental confusion. The correct answer is option B hypotension. Hypotension is the most common complication associated with spinal anesthesia. The next question. Overdose of heparin is treated with. Options are option A aspirin, option B vitamin K, option C protamine, option D all of this. Overdose of heparin is treated with protamine sulfate. Option C is the correct answer. This is one of the previous MLSP question. Antidote are important area. Here vitamin K is there. The antidote of warfarin is vitamin K. And protamine sulfate is for antidote of heparin. The next question. Position used in childbirth and pelvic examination is. Options are option A Sims position, option B Trendelenburg position, option C lithotomy position, and option D Fowler's position. Correct answer is option C lithotomy position. The use of lithotomy position is for gynecological examination and treatment and during surgical procedure involving genitourinary system, childbirth, pelvic examination, all lithotomy position. The first position, Sims position. Sims position is also known as left lateral position. This position is used for vaginal and rectal examination. Next position is Trendelenburg position. In this position, the patient lies on his back and the foot of the bed is elevated at 45-degree angle, and mainly this position is used during the examination or operation of the pelvic organ in order to displace the intestine from the pelvic cavity. And also this position is used in what? To treat shock and decrease blood pressure. Next position is Fowler's position. Fowler's position mainly used to given to relieve dyspnea, and also in case of peritonitis and all we are giving Fowler's position. Okay. The next question. Most poisoning occurs through the body by which route? Options are option A injection, option B inhalation, option C injection, option D absorption. So most of the poisoning enters the body through ingestion. Option C is the correct answer. By taking mouth, it will goes to the intestine. That is injection method. Option C is the correct answer. The next question. Anticoagulant used in pregnancy is. Options are option A warfarin, option B pethidine, option C heparin, option D coumadin. And the correct answer is option C heparin is the correct answer. This heparin is an anticoagulant which can be safely given during pregnancy, and this will prevent the occurrence of new clot. Option C is the correct answer. The next question is. Heart sounds are produced by. Options are option A synod, option B contraction of ventricles, option C closure of heart valve, option D contraction of atrium. Heart sounds are produced by closure of heart valve. Option C is the correct answer. Heart sounds are S1, S2, S3 and S4. S1 and S2 is normal heart sound. S3 and S4 are heard during any abnormalities. Okay, S1 and S2 is known as lub and dub. S1 is produced by closure of bicuspid valve or tricuspid valve or mitral valve. Okay, S1. S2 heart sound is produced due to the closure of semilunar valve or aortic valve or pulmonary valve. This S3 is known as ventricular gallop and S4 is known as atrial gallop. This S3 and S4 are abnormal heart sound. They are produced during any abnormalities. Ventricular gallop and atrial gallop. S3 is ventricular gallop, S4 is atrial gallop.